केमिस्ट्री पार्ट थर्ड। चलिए शुरू करते हैं 201 से। विच ऑफ द फ्लोइंग इज कॉल्ड एज लाफिंग गैस इज नाइट्रस ऑक्साइड N2O। इनऑर्गेनिक गैस इज यूज एज एनेस्थेटिक इज नाइट्रस ऑक्साइड। Which statement is correct for electrolyte is substance that ionize when dissolved in suitable ionizing solvents. Solution of acid, base and salt conduct electricity. It should maintain the ionic and pH balance in human body. All of this. Sodium chloride solution is used as eye drop and nasal drop is 0.9% of NaCl solution. In human body, electrolyte is used to regulate electrolytic balance in whole body, maintain blood pH and ionic balance, help to maintain nerve and muscle function. All of this. Osmotic pressure is maintained in human body is sodium and chloride ion. Sodium chloride dextrose injection contain 0.9% of NaCl and 2.5 to 25% dextrose. Naturally occurring potassium chloride consists of mixture of potassium chloride and magnesium chloride. Assay of the potassium chloride is based on the Morse method. ORS contain sodium chloride, potassium chloride, dextrose, sodium citrate and dextrose. Calcium lactate is hydrated calcium salt of true hydroxypropionic acid. The activity of radioactive particles passing through biological tissue depends on ability of the radiation to penetrate tissue, energy of the radiation, surface area exposed. All of this. Which radioisotopes are used for the diagnosis of thyroid gland is iodine 131. Which of the following is used as urinary and fecal marker is calcium 46. Barium sulfate is used to diagnose gastrointestinal tract. Limit test is used to detect presence of impurities in the substance and turbidity and opalescence. Arsenic impurities are present in acidic medium is arsenious acid and arsenic acid. A limit test of iron, the color is obtained due to the formation of ferrous salt. The nature of ammonium chloride is acidic, used as an expectorant. Ammonium carbonate assay is based on the principle acid-base titration. Ephedrine is used as a bronchodilator. For the treatment of nausea, which class of drug is used is antiemetics. Which of the following is a maintains acid balance in the body is calcium ions. Mechanism of expectorant activity of ammonia is local irritations. Antimony potassium tartrate is used as treatment of leishmaniasis. The assay of antimony potassium tartrate is based on the iodimetry. Potassium iodide is used as antitussive. Which of the following is used in case of poisoning is antidote. Which of the following is a chemical antidote is sodium thiosulfate. Which of the following is a mechanical antidote is charcoal. A mixture of sodium nitrite and sodium thiosulfate used in the treatment of cyanide poisoning. In corrosive poisoning, the antidote is used of charcoal. Quality of the drug is controlled in India is Drug Standard Control Organization by Ministry of Health. Testing and approving of the raw material and finished product is controlled by Analytical Control Laboratory Department. In the limit test for chloride, standard solution is a 0.082% WYV sodium chloride solution. To carry out limit test for sulfate and chloride in potassium permanganate, it's boiled with ethyl alcohol. It is done to destroy color. In the limit test for sulfate, standard solution is a sodium sulfate solution. In the limit test for sulfate, HCl hydrochloric acid is added to to prevent the precipitation of barium carbonate. In barium sulfate reagent used in the limit test for sulfate, potassium sulfate is added to increase the sensitivity of the test. In the limit test for iron, ammonia is added to make the solution alkaline. In the limit test for iron, citric acid is added to prevent the precipitation of iron hydroxide. The lead acetate cotton wool is used in the limit test for arsenic to trap the hydrogen sulfide gas. Standard solution of arsenic contain arsenic acid. Lead diathiazone complex possesses violet color. In arsenic limit test apparatus possesses the long tube, the length of which 200 mm. Hydrochloric acid is administered through straw because it destroys the enamel of the teeth. Sodium dihydrogen phosphate is used as urinary acidifier. Baking soda is a common name for sodium bicarbonate. Sodium bicarbonate is used for electrolyte replenishers, systemic alkalizer, antacid, all of the above. Sodium bicarbonate on heating gives sodium carbonate plus CO2. Sodium citrate on strong heating gives sodium carbonate. Aluminum hydroxide gel IP contain hydrated aluminum oxide with little aluminum carbonate and bicarbonate. Milk of magnesia is a common name for suspension of magnesium hydroxide. Magnesium trisilicate has approximate composition of 2 MgO2, 3SiO2, 3H2O. Prepared chalk is a calcium carbonate. The combination of aluminum and magnesium salt and as acid are used to balance the constipative and laxative effect. Epsom salt is a magnesium sulfate. Rochella salt is a potassium sodium tartrate. Which one of these is an ingredient of universal antidote along with charcoal and tannic acid is magnesium oxide. Galucil is a common brand name for antacid containing aluminum hydroxide and magnesium hydroxide and simethicone. Kaolin is a hydrated aluminum silicate. Which one of these anion is abundant in human body is chloride. Brine is a concentrated solution of NaCl, sodium chloride. Which indicator is used in the assay of sodium chloride IP 1996 is ferric alum. Sodium chloride in hypertonic injection contain 1.6 WyV sodium chloride. Ringer solution is a sodium chloride and dextrose injection. Unishape oral dehydration salt contain sodium chloride plus potassium chloride plus sodium bicarbonate plus dextrose. Calcium gluconate is used as an electrolyte replenisher. Metabolic acidosis is treated by sodium bicarbonate or sodium citrate. Hartmann solution is a compound sodium lactate solution. Hypokalemia occurs due to the deficiency of potassium. Which of these is a major cation in intracellular fluid is potassium. Which one of these is used in metabolic alkalosis is ammonium chloride. Ammonium chloride is used as a systemic acidifier, expectorant, diuretic, all of the above. Mordant black is used in the titration of calcium lactate and gluconate. Nitrobenzene is added in the assay of sodium chloride to prevent the reaction of insoluble AgCl with NH4SN. Hematinics are used in the deficiency of iron. Green vitriol is a ferrous sulfate. Tritant used in the assay of ferrous sulfate tablet is stearic ammonium sulfate. Which one of these iron preparation is scale preparation is iron and ammonium citrate. ferric ammonium citrate agar is deliquescent. Which one of these titan is used in the assay of ferric ammonium citrate is sodium thiosulfate. Ferrous salt with organic acid is preferred because these are less astringent and less irritant. Zinc chloride is used as a astringent. Potassium iodide is used as an expectorant. Tincture of iodine is used as a weak iodine solution. Iodine is more soluble in chloroform. Ammonium chloride is dried by drying our desiccant. A isotonic solution of ammonium chloride contains 0.8 W by V. Ammonium chloride IP 1996 is assayed by acid-base titration. Ammonium bicarbonate is basic in nature. Tritan used in the assay of potassium iodide is potassium iodate. Tartar emetic is potassium antimony tartrate. CuSO4 5H2O is blue in color due to the presence of water of hydration. Copper sulfate IP is assayed by iodometric method. Zinc sulfate is used as a astringent. Sodium thiosulfate is obtained by the reaction of sodium hydroxide plus sulfur. Sodium thiosulfate is a deliquescent in moisture but efflorescent in dry air. Sodium thiosulfate is used in cyanide poisoning because it converts the cyanide into non-toxic thiocyanate. Commercially, oxygen is prepared by electrolysis of water.